Ask your doctor or pharmacist if pharmacodynamics has an affordable generic suitable for you.
So we can't prevent it, we can't cure it. Should we then live in fear of Alzheimer's? No, we need to educate ourselves about the disease because though we can't stop it, we can slow progression and improve quality of life. Azelle, how's Alzheimer's diagnosed?
Well, it's mainly diagnosed clinically. You know, you look at symptoms, memory problems, especially short-term memory would be the most common symptom people would present with. Then also disorientation. You know, people would be a bit disorientated for time, for place sometimes, as well as word-finding difficulties. We'd obviously exclude other physical problems, which can also cause memory problems, but we do specific memory testing. We would do brain scans where you can sometimes see changes, but in early illness, it's often more clinical diagnosis.
Well, what about preventative measures? You know, people are all about keeping your brain fit and healthy. Does that really prevent Alzheimer's?
That's all we can do at the moment, really, is to keep your brain fit. And we would usually say that you have to keep your cardiovascular risk factors low. So check your cholesterol, check your blood pressure, check glucose, and make sure that it's all under control. Exercise is very important. They've actually done studies now where they looked at people with mild impairment of their brain functioning and and then comparing people who exercised and people who didn't. And people actually who were in the exercising group, they actually did perform better than on testing afterwards. And then obviously stuff like, alcohol and memory, we know they're not friends, so avoid too much alcohol, avoid smoking. So basically it's leading a healthy lifestyle.
We should all be doing that anyway.
Yes.
We know there's no treatment for curing Alzheimer's, but is there any medication that can slow progression or improve quality of life?
Actually, we have medication on the market now, which won't cure, like you said, but would slow down the progression of the illness. And we really do see in clinical practice that it is helpful. It does slow down the progression and people's quality of lives improve.
You know very well that this is a disease that affects families almost more than it affects the individual. I mean, what do you say to families when they're going through something like this? Because they're really the ones that need the treatment and support.
It's extremely traumatic for them to deal with this. And the best is to support and also to give them a lot of information so that they know what to expect, and also guidelines, how to interact with the person, how to manage them if they get behavioral symptoms, and also to actually contact, I think, associations. For example, Alzheimer's South Africa, Dementia South Africa. Those are associations. They can, refer you to support groups, and we find that family members do extremely well when they are taking part in support groups, because they actually support each other better than we can support them, because they live with it every single day and they actually give each other good advice.
If a family member notices some strange changes and suspect possible Alzheimer's, who should they go and see first? Would they come and see you? Would they go and see a general practitioner? What do you recommend? I mean, what's the first step?
I would recommend a general practitioner, actually, because most of them should know how to screen for memory problems. And they would do basic memory testing, like we call it the mini mental state examination, which is a worldwide test that you can actually look at it on the internet as well, and maybe do a test yourself if you wanted to.
I'm going to do that right away,
but, don't think you're there yet.
Not just yet. Early detection of the illness offers many benefits for patients and their families. So keep an eye out for any of these typical warning signs. A memory problem that worsens over time. Language, difficulty naming objects, finding the right word to use in a sentence. Zips and buttons are difficult to fasten. Hygiene. Those with Alzheimer's may not care about how they look. Extreme mood swings for no reason. Impaired judgment or strange behavior like taking clothes off in public. Many will get lost in familiar places. Even their own family and friends become difficult to recognize. A person recalls childhood memories but can't remember what happened the very same day. And people that are suspicious of other people. So those are typical early warning signs of Alzheimer's. Once the diagnosis has been made, don't try to cope on your own. We've got a national helpline on standby, ready to help. After the break, we're going to talk about how to train your brain. So stay tuned.
Ask your doctor or pharmacist if pharmacodynamics has an affordable generic suitable for you.